Top 3 vitamins that aid in kidney healing and proteinuria prevention. It's possible to find out your risk of developing an illness in the future with a straightforward urine test. You can figure out your urine's protein content by looking at your urinalysis report form. If the amount exceeds 500 milligrams per liter, you can have proteinuria, a condition that can indicate kidney impairment in its early stages. When the renal filtering system is malfunctioning, damage like this occurs. Proteinuria, which is defined as an excess of protein in the urine, is a symptom of renal disease rather than a separate illness. The majority of people are not aware that they have proteinuria. If you haven't watched these videos yet, be aware that proteinuria can be either transient or chronic. Our video will concentrate more on chronic renal diseases, which are frequently the cause of persistent proteinuria. Remember that a decrease in proteinuria can prevent additional kidney damage, saving you from the excruciating discomfort that comes with kidney disease and expensive future treatments. Thus, we'll talk about 3 vitamins in this crucial video that can help prevent proteinuria and aid in the recovery of kidney damage. Learn about the different types of vitamins, their importance, and how to consume enough of them. To find out more about proteinuria's causes and prevention, make sure to watch through to the very end. We hope that by giving you access to this information, you will be better able to make informed eating choices. First though, I kindly ask you to like the video and subscribe to this channel. It is very important for us. Thank you very much. Speaking of vitamins that prevent proteinuria, let's get back to that subject. The kidney's main job is to filter blood and get rid of waste. Excess water and minerals are present in the urine and feces. In order to maintain healthy blood pressure levels, the kidneys assist in maintaining a fluid balance. Normally, urine does not contain protein leakage from the body. It is evident that any decrease in proteinuria will prevent additional kidney injury. People with renal disease may have low levels of some vitamins. By healing kidney tissue, supplying these vitamins through dietary consumption or supplementation may help enhance renal function. More precisely, individuals may have low levels of several vitamins for a variety of causes related to renal impairment. First, along with proteins, these vitamins may seep into the urine due to damage to the glomeruli. Second, a distorted taste and decreased appetite may be associated with malnutrition, which is frequent in people with kidney failure. It could also come from consuming a diet deficient in foods high in nutrients. Third, physicians could advise reducing particular foods when kidney impairment gets worse. Foods including some legumes, fruits, vegetables, and dairy products should be avoided in cases of severe kidney disease. These have a lot of potassium or phosphorus, which can be harmful if the body isn't able to adequately eliminate it. Finally, dialysis, a mechanical blood filtration system, is necessary for patients whose severe illness has rendered them incapable of using their kidneys. The method poses additional difficulties in achieving the right vitamin levels. Here, we'll examine the vitamins that can prevent future kidney disease damage and assist reverse proteinuria. Vitamin D will be the first vitamin we talk about. For various reasons, vitamin D can aid in the recovery of kidney injury and proteinuria. First, inflammation in the body can be reduced by vitamin D. Protein leakage results from kidney inflammation that enlarges the glomeruli, which are small, tube-like filters. Reducing inflammation could lead to a decrease in proteinuria. Additionally, vitamin D supports renal blood pressure homeostasis. The kidneys try to enhance blood flow to the affected area when they suffer injury to their tissues. But eventually, the high force results in even more harm and inflammation, which sets off proteinuria. Renin and angiotensin, 2 hormones and enzymes that can raise blood pressure in the kidneys, are secreted less frequently when vitamin D is present. Vitamin D also aids in the synthesis of antioxidants. Antioxidants lessen the harm caused by dangerous chemicals called free radicals. Free radicals are created by normal bodily functions like the use of oxygen and the breakdown of food. The primary cause of proteinuria, further harm to the glomerular filtration system, is stopped by these antioxidants that bind to free radicals. The kidney's filtering system cells may not create scar tissue as a result of vitamin D's protective properties. The function of the glomeruli may be improved by limiting the formation of scar tissue, which would reduce the amount of protein lost in the urine. On the other hand, Research on vitamin D's ability to reverse proteinuria and aid in kidney recovery is still up for debate. A 2019 study examined the potential impact of vitamin D3 supplements on kidney function and was published in the Journal of the American Medical Association. More than 1,300 type 2 diabetic patients were evaluated by researchers. After 5 years, there was no noticeable improvement in glomerular function with vitamin D3. A different 2019 meta-analysis that looked at trials covering around 1,500 individuals was published in the journal Kidney Blood Press Research. Diabetes-related kidney disease affected these patients. Multiple kinds of vitamin D administration were found to decrease urine protein levels. Make sure you are getting the recommended amount of vitamin D for your body. Individuals with any stage of kidney injury or illness must consume enough vitamin D. The consumption of vitamin D supplements ought to be customized and prescribed by medical advice. Adults over the age of 19 should aim for a short intake of 600 international units, or IU, which is equal to 15 micrograms a day. In order to receive 800 international units, or 20 micrograms per day, individuals over 70 must consume more. Many people only receive a small amount of exposure to sunshine. The suggested dosages take this into account. There are other ways to raise your levels, such as getting sunshine, eating foods that are naturally high in vitamin D, and consuming fortified meals. However, if you intend to take vitamin D, there are a few things you should know. First off, bodily tissues store vitamin D, which is soluble in fat. Excessive supplementing could lead to hazardous dosages. People who have excessive blood calcium levels or kidney stones should exercise extra caution. Supplementing with vitamin D can raise blood levels of absorbed calcium even further. Stone formation might rise as a result of this. Finally, it is not advisable to take vitamins with D levels higher than 4,000 international units without a doctor's supervision. It is possible to take vitamin D at any time of day in terms of timing. But the optimal time to absorb this vitamin is after consuming foods high in good fat. There are 2 types of vitamin D that you might come across when shopping. D2, ergocalciferol, and D3, cholecalciferol, are the 2 types. Over time, vitamin D3 might be more successful at increasing your blood levels. Foods that are naturally high in vitamin D include salmon and mackerel, as well as cod liver oil. Vitamin D levels are also naturally high in liver and egg yolks. Moreover, mushrooms that have been exposed to UV radiation have significant vitamin D contents. Dairy products and plant-based milk are examples of fortified foods high in vitamin D. Lastly, fortified foods like yogurt, orange juice, and some cereals may also help mend kidney damage and contain large levels of this vital vitamin. To find out how much vitamin D is in foods that have been fortified, carefully study the nutrition facts label printed on the back of food packaging. So far, do you find our video enjoyable? If so, kindly provide us with some help by leaving a like, and we'll create more content along these lines. Vitamin E is number 2. Vitamin E is the second vitamin that may help repair the kidneys and lessen the amount of protein that leaks into the urine. Kidneys may benefit from vitamin E in a number of ways. First, in terms of its ability to lower inflammation and shield tissues from the damaging effects of free radicals, vitamin E and vitamin D are comparable. Vitamin E in particular protects cell membranes from damage caused by free radicals. Additionally, a process known as autophagy, which vitamin E aids in, may allow renal filtration system lining cells to mend themselves. Autophagy is necessary for cells to operate normally. Vitamin E may encourage cells to use less energy by reducing the amount of autophagy they carry out. This vitamin might also be involved in making sure autophagy proceeds all the way to completion. Vitamin E may also lessen the quantity of waste that accumulates during this process. Proteinuria and overall renal function may be improved by advancements in this cellular maintenance. Research demonstrating vitamin E's advantages are encouraging. A tiny study from 2021 examined 59 people and was published in the journal Nutrition. The patients included in the study had stage 3 chronic kidney disease, CKD, a more advanced form of the disease, along with diabetic renal disease. The individuals also had microalbuminuria, an early form of proteinuria. Although the initial research showed improvement, the subsequent investigation did not show a substantial decrease in proteinuria. The author points out that researching vitamin E is complicated. When deciding to raise your vitamin E intake, bear in mind these crucial guidelines and safety measures. 15 milligrams of vitamin E per day is the recommended dosage for adults 19 years of age and above. Furthermore, depending on the severity of the condition, larger doses of vitamin E may be needed for people with kidney problems. A brief course of 200–400 milligrams per day is possible, but only under your doctor's guidance. Overindulging in vitamin E may have detrimental effects on the body's ability to create blood clots. Prolonged high-level vitamin E consumption may also raise the risk of several cancers. Vitamin E is fat-soluble and is kept in the body's tissues, just as vitamin D. Consuming excessive doses over long periods of time can lead to the buildup of dangerous amounts. It's imperative to see a doctor before taking vitamin E supplements if you have any medical concerns or are taking medication. Your body's vitamin E levels may be impacted by how you consume it. Vitamin E can be taken at any time of day. On the other hand, some people take vitamin E at night to help with insomnia. Since vitamin E is a fat-soluble vitamin, it is best absorbed when taken with foods that contain healthful fat. When purchasing vitamin E, keep in mind that separate supplements may have higher dosages than vitamin E included in multivitamins. These levels are usually far greater than the 15 milligrams daily suggested limit. Vitamin E content is naturally high in many foods. Sunflower seeds and nuts like peanuts, almonds, and Brazil nuts are some examples of them. Vitamin E content is also high in wheat germ and vegetable oils, such as soybean and safflower corn. Moreover, vegetables with high amounts include red bell pepper, pumpkin, and asparagus. Meat, collards, spinach, and other greens are good sources of vitamin E. Mangoes and avocados are also good sources of vitamin E. Third, folic acid, or vitamin B9, sometimes referred to as folate. We will now talk about the advantages of vitamin B9 in treating renal disease and preventing proteinuria. Low vitamin B9 levels are also frequent, especially in patients with severe kidney disease. First, vitamin B9's antioxidant qualities, similar to those of vitamins D and E, can aid in reducing inflammation and shielding kidney tissues from harm caused by free radicals. Second, by lowering the risk of blood clots, vitamin B9 supplementation may lessen damage to dialysis access sites in patients receiving treatment. Third, in patients with severe kidney illness, vitamin B9 may help lessen the negative consequences of elevated blood phosphorus levels. One of the issues is binding to calcium, which weakens bones and causes tiny stones to grow in various body parts. Moreover, homocysteine, an amino acid found in blood, is broken down by vitamin B9. In patients with severe kidney illness, elevated homocysteine levels may raise the risk of blood clots, cardiovascular disease, and kidney inflammation. One extensive investigation demonstrates the helpful role vitamin B9 had in mending renal injury and lowering proteinuria. A review of the China Stroke Primary Prevention Trial, a big study, was published in the American Journal of Kidney Disease in 2020. More than 1,300 patients with high blood pressure and early to mid-stage chronic renal disease were examined in the initial trial. Over the course of 4 years, the results demonstrated a higher than 80% decrease in the progression of renal disease after taking daily B9. Based on the way the body absorbs vitamin B9, guidelines are made about daily dosage. Folic acid is the form of vitamin B9 that is added to meals or supplements. Compared to folate or vitamin B9 in its naturally occurring form in diet, the body absorbs folic acid more readily. Consequently, micrograms of daily folate equivalent are used to indicate the necessary daily intake of folate. Adults over the age of 19, or DFE for short, should take 400 micrograms of folate equivalent every day. This quantity is equivalent to 400 micrograms of folate and 240 micrograms of folic acid. Remember that consuming more than 1 milligram of folic acid per day should come from fortified foods or supplements. A high-dose folic acid supplement, 5 milligrams daily, may be recommended for those with end-stage kidney disease, or ESKD for short. but you should only use powerful supplements under a physician's supervision. Taking vitamin B9 should be done with prudence. Red blood cell formation is aided by iron and both vitamins B9 and B12. Taking more than is advised could conceal vitamin B12 insufficiency symptoms. Additionally, consuming more vitamin B9 than is advised may accelerate the development of several cancers. You may get vitamin B9 in multivitamins, prenatal vitamins, and B-complex vitamins. Vitamins containing methylfolate are also accessible to people who have the MTHFR gene mutation. Make sure you consume the daily necessary quantity of vitamin B9 by checking the labels of fortified foods. Vitamin B9 is included in a wide variety of foods. Vegetables with dark green leaves, such as spinach, kale, and arugula, are rich in folate. Broccoli, asparagus, and Brussels sprouts are a few more plants that are rich in folate. Eggs, walnuts, flax seeds, and legumes like kidney beans and peas are additional foods high in folate. Lastly, high folic acid content can be found in fortified breads, cereals, rice, pasta, and corn masa. Make sure you discuss with your physician the advantages of taking vitamins B9, E, and D9 to help heal your kidneys and prevent proteinuria. Precautions. We'll speak about when to address renal problems with your doctor today. To learn important details regarding the causes of proteinuria and how to prevent it, watch this video through to the very end. We talked about how proteinuria indicates your future risk of illness earlier in the video. We said that diabetes, high blood pressure, and heart failure can result from renal injury. See your physician about kidney damage prevention and treatment options. You might be able to achieve ideal health with this. The presence of protein in your urine may become apparent as the damage increases. It could have a frothy, bubbly, or dark appearance. You can notice facial or limb puffiness. Edema is the accumulation of fluid throughout the body that occurs when the kidneys are unable to filter excess fluid into urine. You might want to puke up or vomit. This sensation is brought on by waste building up in the blood. Because of the imbalance in salts and minerals, you can have cramping or twitching in your muscles. These symptoms might not show up right away and might get worse over time. Consult your physician as soon as possible if you encounter them. Additionally, get aid right away if you experience chest pain or shortness of breath by calling an ambulance. Before making big dietary or vitamin changes, always get advice from a healthcare professional, particularly if you have chronic renal disease or other medical issues. You've learned so far in this video that kidney disease can be indicated by proteinuria. We talked about how vitamin supplements can assist treat renal disease and prevent proteinuria. You've also probably heard of symptoms that renal troubles can cause later on. Now let's quickly review vitamins D, E, and B9. Watch to learn about the causes of proteinuria and how to avoid it. In conclusion, vitamins D, E, and B9 are frequently deficient in individuals with renal impairment. These vitamins might be useful in treating kidney damage and putting an end to proteinuria. These vitamins contain antioxidant qualities that guard against free radical damage and are necessary to lessen the negative consequences of inflammation. Making sure you have enough vitamin D also helps lower blood pressure and prevent scar tissue from forming in the glomeruli. In order for cells to operate normally, vitamin E may also aid control cell maintenance and repair. Lastly, vitamin B9 may prevent blood clots from forming at the access sites for dialysis patients. Additionally, vitamin B9 may lower dangerous blood phosphorus and homocysteine levels. The causes of proteinuria are covered in the video's last section. Proteinuria is a disorder that can exist in the body temporarily or permanently. Temporary causes could include dehydration or insufficient water consumption, infections, intense physical exertion, or consequences from heart failure. Proteinuria can also result from kidney stone injury, low blood pressure, or inflammation. Long-term causes. A person's health condition may be the cause of their proteinuria. Over time, the kidneys are impacted by heart failure, diabetes, and high blood pressure. IgA nephropathy and lupus nephritis are two immune system conditions that can harm the kidneys. Proteinuria can also be brought on by intoxication, certain cancers, and injuries. In some situations, it might not always be possible to prevent proteinuria. Here are several strategies to help avoid kidney damage, though. Make sure you lead an active lifestyle, control your blood sugar, consume a diet rich in fruits and vegetables, drink enough water, and take your prescribed medications. We sincerely hope you enjoyed the video and that the vitamin advice and techniques helped you to heal your kidneys and reduce proteinuria. Your support motivates us to keep delivering insightful content. Turn on all notifications by tapping the bell icon to ensure you never miss a life-saving video. Thank you and bye.